Welcome to Medically Speaking. It's National Laboratory Professionals Week. Our guest today is Keith Hoerth from Kaleida Health. Keith, thanks for joining us today.
Thank you for having me. Glad to be part of this.
Yeah, so it's been quite a year for laboratory professionals with all the work that has gone in, not only with your day-to-day responsibilities with the hospitals and in the community, but really COVID-19. So if you can talk a little bit about, really what this past year has brought for the Kaleida Health Laboratories and the workforce there.
It's been a crazy yet exciting year for us. And actually, before COVID even hit, we were running roughly 250,000 tests a month. It had some pretty good volume coming in. And then COVID hit and dropped our volumes by almost 50% right away. But at the same time, we were scrambling to try to get platforms up and running and do COVID testing. And we were the first health system in Western New York to be able to offer COVID testing. So it was amazing. It's been just a heroic effort by the lab staff to get testing going and constantly pivoting between different platforms and vendors based on what we had for supplies and what we were able to do. And quite an amazing job by our lab staff.
Indeed. And before we get into some of the details of the past year of COVID-19 and how the lab responded, I do want to go back and talk a little bit about what you mentioned at the beginning, and that's the work that's done on the monthly basis, the amount of tests that you run. Give the viewers an idea of, who you're running them for, and what that work is designed to do.
So previously, it would have been samples that were routines for inpatients come over to our Flint Road location or run at our hospital sites. There's also stats for emergency department and OR. And then we had a lot of samples that were coming from outpatient clinics, people going into their primary care or even specialty doctors where samples would come in. The normal tests that we were running are also basic ones where they're automated. You get a sample in, you can put them on a device. Whereas when we went to COVID testing, it's a lot of manual processes. So there was a huge shift over for the staff to really be part of this testing process and having to be more integrated into it than what they were before. And it was, again, amazing what they were able to do.
If someone's thinking about a laboratory setting, what did you guys do different? Is it just a different machine? Is it a different lab setting? Is it a different work process? Explain for the viewers what that means.
Oh, all of the above. So we had to be really flexible this last year with our COVID testing. And we didn't just go with one vendor or one model of instrumentation. We had 8 different platforms that were running COVID at any specific time. And the reason why we had to do it is you never knew who you were going to be able to get supplies from and what you were able to run. So one day you'd be having plenty of supplies from one vendor. The next day they would tell you that they were on back order because the federal government stepped in and moved supplies somewhere else. So you always had to be pivoting. So every day this lab staff would come in and sometimes wonder, which device am I running today? And it was amazing how much they could pivot and change over. So we had to be very flexible. We had to really scale up the different models and different platforms that we were running with in order to keep the volumes going and be consistent and steady with what we're doing throughout the year.
Now, did you ever think that the labs were going to be, thrust to the forefront of media attention, hospital systems, when the situation arose like this? And, how did the staff respond knowing that you guys were at the forefront of this?
Good question. And no, we did not expect to be at the front of this. Lab staff are always kind of behind the scenes, although we know that we're 70% of all medical decisions. The providers use the data that we give them in order to decide what's going on with the patient. But again, we're usually behind the scenes. So this was new and unique to us. And it was very interesting to see almost every day in the media hearing of lab testing and volumes and what was going on there. I don't think the staff expected it at all. And there was a lot of praise for staff members, especially some of them were probably some of the most important people in Western New York at one point because they were the few that knew exactly how to run this test and were able to ramp up and keep this going, especially when others weren't able to keep up with their supplies. So not expected, but we were very grateful for what the staff were able to do.
So looking back to the start of the pandemic, say last spring, testing became, a very important metric. It was as key to driving down, COVID-19 positivity rates. Talk a little bit about the work, the processes that you guys needed to have in place to make sure that not only, the Kaleida Health workforce was safe, the patients we care for were safe, and then the community safety was ensured.
Yep. There was a lot of dedicated hours that people were putting in. First, just to get the platforms up and running. A lot of these devices, we had to bring in supplies, validate them, make sure we had good quality tests. But the staff were constantly working through just the processes of getting samples in, making sure that they were coordinating with the people collecting, making sure that all the samples were labeled and just accessioned appropriately, and then getting them through our devices in a timely manner. And it was a ton of work, especially with some of the platforms being very manual, to be able to get samples through as quickly as possible. We never got to some of the delays that you heard from some of the national labs where they were 14 to 21 days out with some of their samples. We always maintained at the most was a 4 to 5 day period. And really, we're trying to always shoot for that 24 hours or less and try to get samples through as quickly as we could. And we're at that point right now as that 24-hour period for most of our samples and doing pretty well with that.
So we saw the first spike spring of 2020, obviously the fall, early winter 2020, the second wave of COVID. We're into 2021. Vaccination is underway. There may or may not be another spike. There may be COVID here for a long time. What are some of the challenges that you guys are focused on to make sure that you guys are prepared to deal with COVID-19 as we move forward?
It's constantly just monitoring what's going on and just the rest of the nation and making sure that we have the appropriate supplies. We still maintain the platforms that we have. So if we need to pivot back to something, we always can do that. And just really also thanking our staff, trying to get them some time at this point as we are in a little bit more of a stable environment, and making sure that they have some time with their families and time to enjoy and relax for a little bit. If we do get up into another spike, I know that they're going to be dedicated and back into it. So this is a good area and time for them to just take that breather and take that moment. And especially as we get into lab week, enjoying that too, and just taking that as a moment to be grateful for what they've done and be proud of themselves.
Yeah, you mentioned National Laboratory Professionals Week. If you can, for the viewers out there, talk a little bit about what some of the industry opportunities are. If people have interest in a career, how does someone go about doing something like that?
For people getting into the lab field, there's tons of jobs that are out there. It's an area that there's a national shortage of laboratory professionals, and it's anywhere from phlebotomists and even our courier staff all the way up through people that are cytotechs and histotechs and clinical lab scientists and pathologists. There's plenty of different areas in the field. Kaleida Health is a great place to work. We have open spots, and we also have some new technology that's coming into play in the next year. We're expanding our IT platforms and really getting into the future of what the laboratory field should be. So plenty of open positions, plenty of good technology. It's a great spot for somebody that's in high school that loves STEM, loves the science and technology, because we have all of these automated platforms that they get to play around and work with. So it's a great field for somebody, especially if they love to help people, they love science, technology, and really, want to get into a field like that.
So as we wrap up here, Keith, it's been a wild year for you and your team and the entire laboratory staff. Any special message of thanks or gratitude for those who have been working side by side with you and the team there this past year?
Definitely. Have to thank my staff. They were true heroes throughout this. And many of them, just the dedication and the time that they put in to keep these tests going, it was truly amazing, and just a great team effort.
Keith Hoerth is the Vice President of Kaleida Health Laboratories. Thanks for joining us on Medically Speaking today.
Thank you very much. Appreciate it.